Although the brain registers pain in the rest of your body, it cannot feel pain itself. There are no pain sensors in the brain.
Welcome back to the Conemaugh Connection. We're here at the East Kentucky Science Center, where Evergreen Exhibitions is presenting Brain, the world inside your head. Doctors say people often don't recognize the warning signs of stroke. In just a few minutes, we'll give you an easy way to remember those signs. Here at the East Kentucky Science Center, visitors can explore a real human brain from all angles. And now, thanks to the latest technology, so can doctors at Memorial Medical Center. My dad Rex is funny, helpful, smart, and able to recall the smallest detail of things that happened years ago. Just don't ask him what he had for lunch or where he parked the car.
Unless I see the newspaper, chances are I can't tell you what day it is, whether it's Tuesday or Thursday.
My dad is one of an estimated 10 million Americans with a brain aneurysm, a balloon-like enlargement of an artery in the brain. My dad was lucky. Instead of bursting, his aneurysm leaked, causing him to go into a seizure.
At first, knowing Dad, I thought he was fooling around. I really did. And then because he was making a funny noise, and then I realized that he was having a seizure.
Now, 26 years after surgery to clip his brain aneurysm, Dad lives with short-term memory loss, a diminished sense of direction, vision, and ability to concentrate. Despite all that, he considers himself fortunate.
I've been very lucky. And particularly having your mom to support me both emotionally and financially, I've been lucky.
And patients facing a similar surgery today are even more fortunate. Because technology, like the new ARTIS Z angiography suite at Memorial Medical Center, is giving surgeons an advantage they did not have before.
Traditionally, old angiographic suites did everything just two-dimensionally. Now, we can do one spin in about a 270-degree arc and take that reconstructed image and look at it in every plane. So we've now just reduced the contrast, we've now reduced the radiation dose to the patient, and we've also now found almost what the surgeons like to call a surgical view. They can actually perceive the images exactly how they're going to see them when they're inside operating on a patient.
The only system of its kind between Philadelphia and Cleveland, doctors say the images are spectacular.
We can then apply that technology not only for the brain, but for the chest if we're doing something in the chest, for the pelvis if we're doing a uterine artery embolization on a female.
New technology is also having an impact on other brain-related diagnoses and treatments, like Gliosite for brain tumors.
So when I remove the tumor, I implant this special balloon which will hold the liquid radiation. The patient can go home and let the radiation do its work. They receive the radiation at home over 3 to 5 days, and then once the radiation is complete, they'll come back to the hospital, then I'll remove the balloon. And it's always going to improve patient survival because you're providing more radiation safely. You can provide a higher dose, you provide it in a way that you're not going to damage the normal brain.
Studies show Gliosite can improve patient survival by 43%.
Cancer is not a death sentence anymore. People with cancer are surviving their cancers, doing very well. There are plenty of treatments available. There has been tremendous explosion in knowledge, newer treatments, and cancer in general.
In fact, success in treating cancer patients has led to higher volumes and the need for Memorial's Cancer Care Center to welcome another medical oncologist, Dr. Hassan Bitt.
The cure rate is higher now compared with before. Even if we cannot cure the patient, we can control the disease for a longer time. We can prolong the survival of patients with brain tumor nowadays, as well as patients with other types of cancer.
And doctors, while excited about the new technology they have now, believe even greater things lie ahead.
We've started targeting the genes of the cancer cells. And this treatment is fancy treatment, but with excellent outcomes. I believe that during my time, in the coming few years, that patients with cancer will come in and will enjoy a very good life, with the cancer being controlled, minimal side effects from the treatments, and the suffering from cancer as general will be gone.
For more information on the treatments and technology highlighted here today, log on to our website at www.conemaugh.org or call our Nurse Connection at 1-800-587-5875. Coming up, he was just acting a bit off, a little confused. Find out how quick thinking and knowing the warning signs of a stroke made all the difference.
I hope it will take their mind off their illness, help them get over it faster, give their parents and the nurses a break, that they'll be occupied for a little while.
Did you know that your brain is divided into two sides? The left side of your brain controls the right side of your body, and the right side of your brain controls the left side of your body.